Mucormycosis or black fungus has become something that a lot of policymakers, the government, doctors are very worried about. We are told that in the All India Institute of Medical Sciences, they would get about 10, 12 cases in the entire year. Now they're seeing that number in one particular day. Uh, is this something that you think is particular just to our country, Dr. Yunus?
I think there may be increase in the region because we have seen COVID ravaging through Europe and North America, but I don't think we have seen that degree of increased cases of mucormycosis or black fungus. Now, why it may be a higher incidence in Nepal or India or Pakistan, there are some hypotheses. Of course, there is a trifacta. So the fungus is in the environment, is in the soil. And what predisposes a human being is diabetes, steroids, or immunosuppressive drugs. COVID by itself, I don't think predisposes anyone to mucormycosis. It's the treatments of COVID. So if steroids are being used in very high doses, or if patients have immune suppression, or they're having cancer, dialysis, those situations, and then depending upon what kind of environmental exposure they get, because if they get a big dose of that soil that's carrying this fungus and they're immunosuppressed, then yes, chances are that they're going to have a higher risk. And I think those conditions prevail more in the subcontinent as compared to Europe and America. But right now, once again, the focus should be at the appropriate use of medications at the early diagnosis, because what I'm hearing is people are just using steroids like water, and I've talked about it for so many times that it's precision that matters. When you are a good clinician does not do more, does not do less. A good clinician does just right. And as long as you do just right, you will not do harm.
You're saying good clinicians. So are you saying that the what might be going in this particular case of black fungus is that doctors are jumping the gun, or do you think people are self-medicating?
Both could be possible because when you look at the trial from UK Oxford, when they first talked about steroids, it only helped in people who were hypoxic, meaning they needed oxygen support or who were on a ventilator. If you're home, if you're not requiring oxygen, if your pulse ox is over 94, then you're going to actually do harm by taking the steroids. That's what's shown in the trial. And what I have seen, even doctors feel compelled to write 8 or 9 things in regular patients who typically are going to get better by routine paracetamol. And I understand, I'm a clinician myself. I've treated patients for 25 years. I understand patients come and they feel good when you give them 3 or 4 medications. So I get that. But as clinicians, our job is to do the right thing. And I think once again, it could be both that the doctors are over prescribing it and that the people are self medicating it.
So, what we're seeing is that a lot of the kind of meetings that are taking place at the government and the policy level, they're also to handle the shortage of the drug, the antifungal drug that's needed to tackle black fungus. What else do you think, apart from just telling people like you are that they shouldn't be self-medicating, or telling doctors that they shouldn't be giving an overdose of steroids, what else should they be doing to curb it? Because do you see it curbing? Because every day it seems to be increasing. Gangaram Hospital, I don't know if you're familiar with the Delhi hospitals, but Gangaram it's run by a trust, and they're saying that they've seen more than 100 cases in the last few days in the second wave itself in the capital. So in order to tackle it, are we now, is it part of the wave, the second wave, that we'll keep seeing these cases, or is that something that the government can do that'll put an end to it very soon?
Sure. So I'm a strong believer that good action will lead to good results. We are in control, not the virus. So I absolutely believe that it needs to be stopped. It can be stopped. And you have to give a multifaceted strategy. Number one is preventive. The best strategy is to prevent it, which means you tell people, first of all, I will tell people, look, this does not go from person to person. This is not contagious like COVID. So you first of all need to quell the panic around it. Then you need to educate people about good hygienic practices. You tell them, look, in soil, this fungus prevails. So anything, any practice, anything that you are doing that's keeping you, bringing you closer to that soil may increase your risk. So first is public education. Second is quick diagnosis, because now with all the media attention, I think doctors are probably much more heightened, but typically people don't think of mucormycosis. It's a rare disease. So early diagnosis is really the key, because then third, treatment is not just amphotericin, the drug that typically gets used, but a lot of these patients require aggressive early surgery. Sometimes the eyeball has to be removed. Much of these infections happen in the face and head and neck area. So prevention, early diagnosis, aggressive treatment. But at the end of the day, this is going to go away. This is not the new norm for India. I think people need to understand that they have to get a grip on it, and the numbers have to start going down.
I want to move to something which is again confusing for me, as someone in the media who just reads all of this as part of their work. What's interesting is that, the doctors in India, as frontline workers, as health workers, were the first people to get vaccinated. And yet we're seeing really high numbers of them, dying. Now, what people across the world and experts have said is that while the vaccines may not protect you from getting infected again, from getting an infection, you may get an infection, but it will be mild. It will protect you from hospitalization. How is it then the Indian Medical Association has said, Dr. Younus, that 260 people have died in the second wave in India who are doctors and healthcare workers?
Right. So I think anytime we talk of a death, I think we must contextualize it with the denominator, meaning how many total vaccines have been given. What is the comparison? So last I checked, 40 million people in India have been fully vaccinated. If 400 people died, that will be 0.001%. That's the context. I don't want people to look at actual numbers, 200, 300, 400, because they miss the context. Out of 40 million, 400 will be 0.0001. And now you compare the risk with COVID. And I think nobody understands that better than US and India, because these two countries have been just ravaged with this virus. So this virus, out of 40 million, will probably kill hundreds of thousands of people. So I think, number one, that's first of all the context. Secondly, we don't know the baseline mortality rate. Out of a large population, people will die random times. There is a random mortality going on that we call baseline mortality. So unless you can say that your baseline mortality has gone up, it's very difficult to once again attribute something to a vaccine. Number three, we don't know the confounding variables. I don't know the ages of these doctors. I don't know their how many were obese, how many had immunosuppressive drugs, how many had diabetes. We don't know any of that. So there's a lot of context. And as a scientist, I always keep that final option open. Maybe there is an X factor. Maybe there is something different with this variant that is going on, right? But you can't just put all your eggs in that one basket and say, oh my God, something crazy is happening. No, you look at everything, you contextualize it, and then you say, all right, I got to look at these 6 factors before I draw my conclusion. It's that sort of a situation. I think the headlines, the raw numbers can be very misleading, and people cannot focus on 236. They have to look at the denominator.